COVID updates now from across the region. We start with Nagaland. Well, the state reported 133 fresh cases yesterday. Amongst these fresh cases, 88 were reported from Dimapur, 13 from Kohima, 9 from Kifire, 7 from Zuneboto, 5 from Mokokchung, 4 from Perin, 3 each from Twinsang and Mon, and 1 from Wokha. This takes the total number of active cases in the state to 2,884, while the cumulative caseload has risen to 16,283, with as many as 12,734 recovered patients so far. On to Meghalaya now. The state reported 409 cases in the last 24 hours, taking the total tally in the state to 20,129, with as many as 3,062 active cases. And with 5 fresh casualties, the death toll in the state has also risen to 233. On the other hand, 241 patients were discharged in the last 24 hours after recovering from the illness, taking the total recovered tally to 16,834 in Meghalaya. On to Tripura now. The state reported 133 fresh cases in the last 24 hours, taking the total tally to 37,692 and the tally of active cases to 2,599. And with 4 fresh casualties also reported, the COVID death toll has risen to 408. Meanwhile, with 150 fresh recoveries, the total recovered tally has also climbed to 34,624. And COVID cases also continue to surge in Manipur, with the state registering 424 fresh cases in the last 24 hours, taking the total number of cases to 35,778, with as many as 4,604 active cases. And 13 COVID casualties were also registered in the last 24 hours, taking the death toll in the state to 489. On the other hand, 87 patients recovered from the virus in the last 24 hours, taking the total tally of recoveries to 30,685. On to Arunachal now. The state reported 205 fresh cases and 4 COVID casualties in the last 24 hours. And this takes the total tally in the state to 20,370, with as many as 1,955 active cases. The death toll due to COVID-19 also stands at 64. On the other hand, 179 patients were discharged yesterday after recovery. With this, a total of 18,355 patients have so far recovered from the virus in the state. And Mizoram reported 173 fresh cases today, taking the total tally in the state to 7,796 and the tally of active cases to 1,854. With yet another COVID casualty also registered yesterday, the state's COVID death toll now stands at 22. On the other hand, 86 patients were discharged yesterday after recovering from the illness. And with this latest update, a total of 5,920 persons have so far recovered from the illness in Mizoram. And we also have reactions of the Chief Ministers of Tripura, Manipur and Meghalaya on the current COVID-19 situation in their respective states. Speaking exclusively to Northeast Live, Tripura Chief Minister Biplab Kumar Dev said that the COVID situation in the state is still under control. He added that the state has administered as many as 14.5 lakh vaccinations so far, which Biplab said is the highest number achieved by any Indian state so far. He also pointed out that no decision on imposing lockdown has been taken as of now.
त्रिपुरा में कोविड की परिस्थिति अभी हम लोग इसको लिमिट में रखा हुआ है। त्रिपुरा ने अभी तक 14.5 लाख वैक्सीनेशन कर चुके हैं, तो देश में शायद नंबर 1 है। तो इस कारण से हमारे ये पॉजिटिविटी रेट है 5% के आसपास है, और वो भी अगरतला में ही है। अगरतला के बाहर बिलो 1% है। मैं ऊपर वाला के पास प्रार्थना करूंगा। हेल्थ कर्मी और सरकार काम कर रहा है, जनता भी काम कर रहा है, किंतु साथ ही साथ उनका भी दुआ मैं मांगता हूं जो त्रिपुरा, सिर्फ त्रिपुरा नहीं पूरे देश को ही बचाए। और आज के दिन में त्रिपुरा में ऑक्सीजन हो, मेडिसिन हो, हेल्थ स्टाफ हो, वो पर्याप्त है। और हमने अपने जो सेंट्रल गवर्नमेंट की जो हेल्थ लाइन है, हेल्थ पैरामीटर है, उस हिसाब से हम काम कर रहे हैं। लॉकडाउन मुख्यमंत्री चाहे तो हो जाता है, ऐसा नहीं होना। वो जो लोग डॉक्टर है, एक्सपर्ट है, इन लोगों के जो राय लिया जाता है, जो कंटेनमेंट जोन कितना हो गया, उसका परसेंटेज कितना है, पॉजिटिविटी रेट का है, उसके ऊपर निर्भर करके लगाया जाता है। तो ऐसे ही हम लॉकडाउन लगा देंगे तो राज्य का आर्थिक क्षति हो जाएगी। तो जैसे ही लॉकडाउन का एक पैरामीटर है तो उसमें पहुंचेगी। और मैं तो चाहूँगा त्रिपुरा में लॉकडाउन का परिस्थिति और पैरामीटर कभी ना ही पहुंचे, ये शब्द ना आए, क्योंकि हमको आगे बढ़ना है, इंडस्ट्री चलाना है, डेवलपमेंट करना है। बस सोशल डिस्टेंस मेंटेन करें और मास्क पहने और खुद को जागरूक रखें, बस वही इसका इलाज है। ऑक्सीजन हमारे पास आज के दिन में पर्याप्त है, इसका एक ही इलाज है, ऑक्सीजन चाहिए।
On the other hand, Manipur Chief Minister N. Biren Singh said that people should be more aware of their symptoms so that patients can get timely treatment and the virus can be contained. Chief Minister Biren Singh stressed on the need for creating further awareness amongst the people.
कोविड का मामले देश भर में हो रहा है, लेकिन मणिपुर में हम लोग संभाल रहा है, लेकिन ड्यू टू द इग्नोरेंट अमोंग्स द पीपल्स, क्योंकि जो सिम्टम थोड़ा सा मिलने से डॉक्टर को रिपोर्ट करना है, वो टाइमली नहीं कर रहा है। तो टाइमली रिपोर्ट करने से वी कैन सेव मोर लाइफ, लेकिन वो नहीं हो रहा है। तो इसीलिए हम लोग अवेयरनेस में ज़्यादा फोकस भी दे रहा है।
And Meghalaya Chief Minister Conrad Sangma emphasized that people must get themselves vaccinated so that the COVID-19 situation is dealt with effectively.
Situation is difficult everywhere. Numbers are growing, but we have been trying to work out and maintain that there should be containment, so that the spread is contained. At the same time, we should also ensure that vaccination is done, and that's the only way to ensure that we are able to resolve this problem in the long run.